Welcome back to 101 Addiction Counseling Terms. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. These study presentations are designed to increase your knowledge of addiction topics. It's great for students who are studying for their current program or towards licensure, current counselors, therapists, or mental health professionals just looking to increase their knowledge and to spruce up on what they already know, or the general public. Maybe you're just interested in mental health, substance use, and addiction topics. Either way, I'm glad you're here. Let's get started. Let's go over what you'll get out of this video. First, you'll be able to recognize and define terms 76 through 101. You'll also be able to strengthen your understanding in the following areas: prevention and intervention, nervous system responses, substance use trends, and clinical practices. Put in the comments below where you are watching this from and why you're watching. Are you a student? Are you studying for exams? Or you just enjoy addiction and substance use topics? I want to know. Put it in the comments. And most importantly, please like and subscribe to the channel so you can always know when I'm uploading new study presentations. Let's get started. Term 76 is parasympathetic nervous system. This is the part of the nervous system that helps you calm down after stress. An example would be after a panic attack, your parasympathetic system slows your heart rate down and helps you breathe easier. This is what we call the chill system. It steps in to slow things down after stressful moments. Knowing about the parasympathetic nervous system helps us teach clients how to regulate better after a trigger or craving. Term 77 is sympathetic nervous system. This is a system that kicks in when you're in danger or feel like you're in danger. It's often called the fight or flight mode. An example would be when someone is anxious about a court date. This system may cause sweating, fast heartbeat, or the tightening of muscles. Have you ever felt your body tense up before bad news? That's this system doing its job. But sometimes it can overreact, especially with people who have trauma or anxiety, which makes it critical to address in the addiction work we do. Term 78 is harm reduction. This is a strategy that focuses on making risky behavior safer instead of expecting immediate abstinence. An example would be giving out clean needles or promoting Narcan use. We don't always start at zero use. Sometimes safer use saves lives. Harm reduction is meant to be a judge-free approach that respects the client's pace. Term 79 is craving cycle. This is the emotional and physical loop that leads to drug or alcohol use. An example of a craving cycle could be stress, craving, use, regret, stress again. Breaking the craving cycle means interrupting that loop. We help clients notice these patterns and support them with finding healthier ways to respond. Term 80 is environmental triggers. These are things in a person's surroundings that can spark urges to use. An example would be walking past an old hangout spot where they used to smoke. Environment plays a big role. We teach clients to identify triggers and make small changes like taking a different route or not calling people that can trigger a relapse. Term 81 is protective factors. These are the positive forces that reduce the risk of substance use. An example of protective factors are a supportive family, a steady job, or a faith community. Instead of only focusing on the risks, we boost what's already working. These protective factors are very important in recovery. Term 82 is vaping. Vaping is inhaling vaporized substances through an e-cigarette or vape pen. An example is a teen using mango-flavored vape daily to reduce stress. Vaping might seem less harmful than cigarettes and other substances, but it's still a delivery system for nicotine, THC, and other chemicals. And yes, vape addiction is real and can happen. Term 83 is cross-addiction. This is when a person replaces one addiction with another. An example is someone who stops using alcohol but starts to gamble excessively. We don't just treat the drug, we treat the person. If the underlying issue isn't addressed, the addiction may just shift forms. Term 84 is fentanyl awareness. This is education around the dangers of fentanyl, a powerful synthetic opioid. An example would be teaching youth of how fentanyl is sometimes mixed into fake pills. Term 85 is recovery capital. These are the resources a person has that helps them recover. An example would be housing, job skills, and mental health support. Think of it like a recovery bank account. The more deposits you put into this bank account, support, stability, skills, the better chance you have at remaining in recovery. Term 86 is motivational interviewing. This is a counseling technique to help clients find their own reasons for change. A motivational interviewing technique is to ask questions like, what would be different if you cut back on smoking? It's not about forcing change or preaching to the client. It's about helping them hear themselves say what they want and be able to explain why. Term 87 is abstinence-based treatment. This is a recovery approach where the goal is zero use of any substances. An example would be some 12-step programs who often follow this model. This path has worked for many, but not all. Our job is to match the model to the person and to make sure it's a good fit to reach recovery and maintain recovery. Term 88 is adolescent use. This is substance use that begins during or around the teenage years. An example would be a 14-year-old who starts drinking to fit in with peers. Teen use often begins with curiosity or peer pressure, but it can snowball very fast. Early intervention is key when dealing with adolescent use. Term 89 is synthetic cannabinoids. These are man-made chemicals that mimic THC but can be very unpredictable and dangerous. Examples of synthetic cannabinoids are spice or K2, and they're often accessible and sold at corner stores. These are marketed as legal, but they can be way more harmful than natural cannabis. Term 90 is trauma-informed lens. This means that we understand our client and their behaviors through the impact of the trauma that they've experienced. An example would be a client missing appointments because of anxiety triggered by past abuse. Before labeling someone as non-compliant or lazy, we have to ask what happened to them and understand the effects. A trauma-informed lens changes the way we treat our clients who struggle with addiction. Term 91 is stigma. These are negative labels or judgment about people who struggle with addiction and substance use issues. An example would be calling someone a junkie instead of saying a person who is struggling with addiction, who has a substance use diagnosis. Words matter. Stigma is one of the biggest barriers to treatment. We often have to work to change the language around how we see addiction so we can better help people who are struggling. Term 92 is relapse prevention plan. This is a written strategy to avoid returning to substance use. An example of what goes in a relapse prevention plan is a list of triggers, coping skills, and supportive contacts. We support the client with building the plan before a crisis happens. That way, the client is prepared in the event their risk of relapse increases. Term 93 is co-occurring disorders. This is when someone has both a substance use diagnosis and a mental health diagnosis. An example would be a client with depression and alcohol use disorder. They have to be treated simultaneously because the client is experiencing the symptoms of these diagnoses at the same time. Term 94 is detoxification, or better known as detox. This is the process of clearing substances from the body safely. An example would be a client going to a detox center to stop using opiates. Detox is the first step, but it's not the whole story. It's not the ending. After detox, a client typically enters counseling, inpatient, or community-based services in order to maintain recovery or start the process of long-term recovery. Term 95 is Recovery-Oriented Systems of Care, or ROSC. These are coordinated networks of community-based services that work together to support recovery. Examples of ROSCs include treatment, housing, peer support, and employment services. Clients don't recover in a bubble. Strong recovery-oriented systems of care keep clients connected to the supports they need to maintain recovery over time. Term 96 is screening tools. These are short assessments to check for substance use or mental health issues. Two examples of addiction screening tools are the cage and the craft. Screening tools are just the starting point to open the door for a deeper conversation. It is not a diagnosis or full treatment. It's just a way to start to see what the client needs. Term 97, licensed substance abuse treatment practitioner. This is a licensed professional with specialized training in addiction treatment. An example of a licensed substance abuse treatment practitioner is a counselor who can diagnose and treat clients with substance use disorders. Term 98 is tolerance. Tolerance is needing more of a substance to feel the same effect. An example of tolerance is a person who goes from drinking 2 beers to needing 6 beers just to feel buzz. Tolerance has a way of creeping up quietly and can build fast pace over time. These are the flags we look for when we're supporting someone with being diagnosed with a substance use disorder or issue. Term 99 is community reinforcement approach. This is a treatment method that rewards sobriety with positive life changes. An example of a community reinforcement approach is offering a job or sober housing to reinforce recovery. This approach involves just not saying to not use. We are building a life that makes not using the better option. The client has better options so they can easily choose recovery. Term 100 is behavioral substitution. This is when we replace a harmful habit with a healthier one. An example would be going for a walk or working out instead of smoking when stressed. Substitution is a part of the recovery journey. Term 101 is addiction. Addiction is a chronic condition where someone keeps using despite harmful consequences. An example that someone may be struggling with an addiction is they continue to use drugs and substances even after losing a job or having negative outcomes with their relationships. Addiction is real, and this is the whole reason why we do these study presentations, so we all can increase our knowledge of addiction so that we may prevent addiction in ourselves, but also help others who may struggle with addiction. Okay, it's time to quiz ourselves. This is where we can see how many of the terms we actually understand and can define in our own words, in turn increasing our knowledge, and it helps us on those licensing exams, our addiction programs, or it can help us help a loved one or somebody we know that might be struggling with addiction. All right, I'll read the term out loud and I'll give a short pause. You define it, you write it down, you discuss it with your group, however you want to study, and then I'll go to the next term. Let's get started. Parasympathetic nervous system. Sympathetic nervous system. Harm reduction. Craving cycle. Environmental triggers. Protective factors. Synthetic cannabinoids. Trauma-informed lens. Stigma. Relapse prevention plan. Co-occurring disorders. Detox. Recovery-oriented systems of care. Screening tools. Licensed substance abuse treatment practitioner. Tolerance. Community reinforcement approach. Behavior substitution. addiction, vaping, cross addiction, fentanyl awareness, recovery capital, motivational interviewing, abstinence-based treatment, adolescent use, synthetic cannabinoids, trauma-informed lens, stigma, relapse prevention plan, co-occurring disorder, detoxification, recovery-oriented systems of care, screening tools, licensed substance abuse treatment practitioner, tolerance, community reinforcement approach, behavioral substitution, addiction. How did you think you did? How many were you able to remember? Did you struggle with some? You can pause the video or go back to the beginning. Watch as many times as you like. As you all know, this is part 4 of 101 addiction counseling terms. If you're just joining us, thank you and welcome. You can go back and I will have the link below to the first 3 videos. If you watch all 4 videos, you will have 101 terms to define, and hopefully you have increased your knowledge of addiction counseling terms. If you have learned one thing from this video, please take a moment to like, share, and most importantly, follow so you can know when I have uploads. Take care.